All right, guys, Mod 4 review. Just going to go over a few different things that may be beneficial. This mod is all about medications, mostly. A large focus on medications, when to use which drug, when to give oxygen, when to not give oxygen, what its indications for. You need to know the 5 rights. When, right patient, right dose, right drug, those kind of things. You need to absolutely know those. You need to know how medications work, like what they do. So aspirin, what is its actual mechanism of action? What does it do for the patient? You need to know things like when to use an epi-auto injector and when you as an EMT are allowed to do these things. Do you need medical control to assist with a nebulizer? Those kind of things. What are normal breath rates? We've talked a lot about that. You should really be familiar with normal adult breath rates at this point. Terminology like agonal or Kussmaul's, Cheyne-Stokes respirations, all those should be things you know about. A little bit tricky on airway, breathing, and circulation. If you get a situation-based question about airway, breathing, circulation, remember that's what we go to first, our ABCs. Before we would insert an oral airway, we want to manually open the airway. So if there's something that would be occluding the airway by forcing the head down, then we want to make sure that was removed and the patient had an open airway. So just make sure you aren't jumping. It's always most basic first. So before we drop an airway like an OPA or an NPA, start even more basic with just positioning. And positioning may be moving things out of the way so that they have an open airway. Situation-based questions, again, we are in the point of EMT class where you're going to get a lot of situation-based questions. You need to know what to do in this situation. Know how to diagnose different medical conditions. So if they have a fever and breathing problems, they may be more pneumonia. If they have a lot of wheezes, what does that make them? Just be able to take symptoms and try to match those with different types of medical problems. Remember where you hear wheezes, so that's more lower airway most of the time, right? Those kind of things. We talked a lot about spontaneous pneumos. You know what those look like. You know the difference how croup presents versus epiglottitis versus like a strep throat. Those are all things we need to know. Let's see here. So a lot of terminology. You know what is. I would really focus on those terms at the end of each chapter, making sure you know those terms or write those out if you can't remember them. Cardiac arrest. We've done a lot on cardiac arrest. Just knowing that early defibrillation is key to getting a patient to return. While high-quality CPR is extremely important, we have to get early defibrillation. That's a good way to get them back, right? And then what do we defibrillate? What kind of rhythm is that? I know you're just EMTs, but these questions are expected of you for you to be able to know. You know, it's not like the movies where they have the flat line, which is the asystole, and then they shock it. That's not real life, right? It's got to be VTach or VFib. We can shock. So ventricular tachycardia or ventricular fibrillation, we can shock and get them back. Lots of terminology, you know. You really, really need to know that. You need to know a little bit about insulin, where it's secreted, what creates insulin, all that good stuff. Some symptoms of hypoglycemia versus hyperglycemia. That would be pretty important to know. Normal levels of sugars would be pretty important. How long for thrombolytic drugs? How long does the patient have in a stroke before they need to have thrombolytic drugs per your book, not per the national standard at this point, per your book. So pay attention to that. Some more terminology. What are severe allergic reactions called? All this stuff's in here. I feel like we've gone over a lot of this, so I don't want to spend too much time on it. Where should we administer an epi injector? That's a good thought process as well. You need to know a lot about epi injectors on this. And we haven't talked much about that, so I would really focus on a little bit of time on that. different pain terminology. So you need to know the difference between visceral pain, somatic pain, referred pain, and be able to apply that in a question. So that would be pretty important. I know I gave you those terms already, but please make sure you're focusing on, what is visceral pain? What is somatic pain? What is referred pain? What are those terms mean? What kind of organs do those terms apply to? What are we going to see there? You know the difference between excited delirium and just a typical psychotic episode or bipolar disorder, those kind of things. Being able to determine what actually goes into the excited delirium realm. Need to know what are signs of a closed head injury. What would be a really good external sign? The best answer for a closed head injury, because there's multiple right answers, but the best idea that we would have a closed head injury, what that would be. You need to know why we give dialysis to patients. Obviously, we don't do that in the ambulance, but that's something that they receive. Why would they be going for dialysis treatments? What is dialysis for? Once again, not something we cover much in class, but you would need to know it. Lots of chapters on this, guys. Lots and lots of chapters on this one. 100 questions, all multiple choice. You need to know what some of our different organs do. So what does the liver do? What does the spleen do? What do the kidneys do? What do the lungs do? We've talked about that quite a bit. A couple questions about sickle cell anemia. Once again, we didn't go over that very much, I don't think, so make sure you're studying up on some of these different medical conditions that could affect your treatments. So if you have any questions, feel free to call me, as someone's doing right now, and we'll try to work through it. Good luck.